Good morning, my name is Nelson CALVO. I am a student for psychiatry nurse practitioner at FNU. Today is February 28, 2026. I will be doing a presentation relate to a problem we are facing as a provider. Alcohol and opioid co-use in the United States, a deadly combination. Introduction to the substances. Alcohol and opioids are among the most frequently misused substances in the United States. Alcohol is a legally available central nervous system depressant, commonly consumed in social and recreational settings. Opioids include prescription medications such as oxycodone, hydrocodone, and morphine, as well as illicit drugs like heroin. These substances exert depressant effects on the CNS by slowing brain activity and respiratory drive. National Institute on Drug Abuse, NIDA, 2023. When alcohol and opioids are used together, their pharmacological effects are synergistic. This interaction significantly increases the risk of profound sedation, respiratory depression, accidental overdose, and death. CDC, 2023. History of abuse. Alcohol has been consumed for centuries across cultures, with documented patterns of misuse throughout history. Opioids have a complex medical and social history. In the late 19th century, morphine was widely prescribed before its addictive properties were fully understood. During the late 20th and early 21st centuries, opioid prescribing increased substantially, contributing to widespread misuse and the current opioid epidemic. NIDA, 2023. As prescription opioids became more restricted, some individuals transitioned to heroin use. Concurrent alcohol and opioid use developed both in social contexts and among individuals self-medicating for chronic pain or psychological distress. Prevalence and epidemiology in the United States. The CDC, 2023, reports that alcohol is involved in approximately 18 to 22% of opioid-related overdose deaths, highlighting the frequent co-use of these substances. Data from the Substance Abuse and Mental Health Services Administration 2023 indicate that millions of Americans engage in polysubstance use annually, and individuals diagnosed with opioid use disorder commonly report concurrent alcohol misuse. Although alcohol is legal and socially accepted, its combination with opioids significantly contributes to overdose mortality and the broader substance use crisis in the United States. Risk factors and vulnerable populations. Risk factors associated with alcohol and opioid co-use include history of substance use disorder, chronic pain requiring long-term opioid therapy, co-occurring mental health disorders, e.g., depression, anxiety, post-traumatic stress disorder, genetic vulnerability to addiction, social stressors and environmental influences. Populations at elevated risk include military veterans, older adults managing chronic pain, individuals with limited access to healthcare services, and persons experiencing socioeconomic instability. SAMHSA, 2023. Short-term and long-term side effects. Short-term effects. Drowsiness and excessive sedation. Slowed or shallow breathing. Impaired coordination and judgment. Nausea and vomiting. Increased likelihood of accidental injury. Long-term effects. Development of tolerance and physical dependence. Chronic liver disease related to prolonged alcohol use. Cognitive deficits. Sleep disturbances. Heightened susceptibility to fatal overdose reported by CDC, 2023, and NIDA, 2023. Signs and symptoms of abuse upon assessment. Clinical assessment findings may include slurred speech and unsteady gait, constricted pupils, opioid effect, accompanied by signs of alcohol intoxication, recurrent episodes of heavy intoxication or blackouts, risk-taking behaviors and impaired decision-making, mood instability, irritability, or depressive symptoms, decline in occupational, academic, or interpersonal functioning. Comprehensive screening for polysubstance use is critical when these findings are present. Potential for overdose or intentional self-harm. The concurrent use of alcohol and opioids markedly elevates overdose risk due to compounded respiratory depression. Even therapeutic doses of opioids can become life-threatening when combined with alcohol. CDC, 2023. This combination may also be involved in intentional self-harm attempts, particularly among individuals experiencing psychiatric disorders or acute emotional distress. Early mental health assessment and crisis intervention are therefore essential components of care. Care plan, pharmacological and non-pharmacological treatment. Pharmacological interventions. Naloxone for emergency reversal of opioid overdose, NEDA, 2023. Medication-assisted treatment, MAT, including buprenorphine, methadone, or naltrexone. Pharmacologic management of co-occurring psychiatric conditions when indicated. Non-pharmacological interventions. Cognitive behavioral therapy, CBT. Motivational interviewing, MI. Peer support groups such as Alcoholics Anonymous, AA, and Narcotics Anonymous, NA. Individual and group psychotherapy. Residential or intensive outpatient rehabilitation programs. An integrated treatment approach addressing both alcohol and opioid use disorders is associated with improved outcomes. Patient education, referrals, and follow-up. Patient education should focus on the dangers of combining alcohol and opioids. Recognition of overdose symptoms, e.g., slowed breathing, cyanosis, unresponsiveness. Importance of medication adherence and avoidance of alcohol during opioid therapy. Relapse prevention strategies. Referrals may include addiction medicine specialists, mental health providers, and community-based recovery programs. Ongoing follow-up appointments are essential to monitor substance use patterns, mental health stability, and response to treatment. SAMHSA, 2023. Conclusion. Alcohol and opioid co-use remains a significant public health concern in the United States. The synergistic depressant effects of these substances substantially increase the risk of respiratory failure and fatal overdose. Addressing this issue requires early identification, integrated pharmacological and behavioral treatment strategies, patient education, and sustained follow-up care to reduce morbidity and mortality. Thanks for the attention.